Approximately 3% of babies are born with a birth defect every year in the United States, caused by a number of factors. But here to share how to lessen those chances is Dr. Neena Champaigne, Division Chief for MUSC's Pediatric Genetics. We're glad to have you here with us. And I think when a woman gets pregnant and they're getting ready for the birth of their child, they want to take all the right steps. So what are some of the things that they should maybe avoid to lessen their chances of giving birth to a child with a defect?
Absolutely. Thank you for having me here. There's certainly a lot in prevention that women can do, and so first is just looking at their health and connecting with a healthcare provider to make sure that any underlying diseases, diabetes, weight, their overall health is being looked at, and so that they can be ready to have a healthy pregnancy. Other things are taking things like vitamins. So we know folic acid, for instance, is important for prevention of neural tube defects. Those are defects of the brain and spine. And so that has a very good response in terms of reducing those kinds of things. Other things are looking at what they're taking, exposures, medications that they may be on, alcohol, tobacco, other risk factors. And in genetics, we do like to meet with families and take a family history, a detailed look, and see if there's any risks associated to their genetic background.
Yeah, and on the last note there, so how often do genetics play a role in defects among babies?
So it's hard to tell. We don't understand all of the nuances of birth defects, but certainly there's a number of what we call chromosomal, so they're like Down syndrome. It's probably one of the leading causes for birth defects.
Oh, it is, okay. And is there any way to change the odds? I mean, obviously, if you carry a gene, that you can't remove that gene from your system. So you hear of these different kind of genetic designer babies and things like that. I mean, it just seems like...
Absolutely, we can't change our genes, and so we do know that as women get older, as men get older, that the risk for certain genetic conditions goes up, and so kind of understanding that risk is a first step in trying to understand what may or may not occur during a pregnancy. Nowadays, we have a lot of carrier testing, so couples can get testing in advance to know if they are carriers for a certain condition, and again, just knowing that in advance may help with their family planning.
Yeah. And then let's say a mother is doing everything she can as far as her diet, taking vitamins, all those things, but say COVID hits and we're slapped with a pandemic that we know nothing about, that we have no history with, and now we're being told to go out and get a vaccination, particularly for pregnant women. They were highly advised to run out and get the vaccination. So I mean, should a woman say, let me pump the brakes here, I got to talk to my doctor about it first, or do you think it was safe and well advised for women to go out and get vaccinations for COVID?
I think that's a great question, and I think at the time there were a lot of unknowns, and really talking with your healthcare providers and weighing the risks and benefits, we certainly know that there were certain individuals that were at higher risk to have complications, and so the benefit of a vaccine could minimize that, but we don't exactly know all of the impact of that.
Yeah, but if you're not immunocompromised, then is it safe to say maybe I'll just keep my distance from the public throughout my pregnancy? And
it's a really hard question, I think, to answer, but pregnancy in itself is a high risk.
It is,
and it puts a lot of stress on the woman's body, and so trying to stay healthy throughout the pregnancy and anything that you can do to do that, I think is helpful. And so immunizations do play a role. I think, again, COVID may have not as much certainty, but there's certainly well-established literature that certain vaccines are beneficial to prevent birth defects.
Yeah, can you give us a few examples?
So sure, the rubella vaccine, for instance, which causes forms of measles, other diphtheria, pertussis, again, can prevent illnesses before or during pregnancy. Varicella or chickenpox is another one that, again, can prevent or minimize some of those risks.
Do you think it's better if someone, before they decide to get pregnant, if they can make that choice, because a lot of times pregnancies are unexpected, but do you think that having those vaccinations prior to getting pregnant is the better plan rather than while you're pregnant?
That's certainly ideal, but as you said, it's not always planned. But some of these Vaccinations have been studied over time and have been found to be safe, but again, talking with your provider about the timing and the need, I think is helpful.
Okay. And then once a woman does give birth to a child and they do have a defect, what are their resources, especially here in South Carolina in the Low Country? What resources do they have in order to take the next step in caring for the health of their baby?
That's a great question, and there's a couple of resources. So obviously the South Carolina Department of Health Environmental Control, so DHEC, has a number of programs. So they have early intervention, it's called BabyNet. So those are therapies that individuals can get from birth to age 3. There's also a program for children and youth with special health care needs, and so that can get access to the different services all the way up to age 18.
Oh, wow.
And then there's Family Connections, which is more of a family support system, and so it can give families access to resources around the state.
Oh, terrific. Dr. Champaigne, thank you so much for all that information. Really
You're
appreciate
very
you coming
welcome.
on. We're back in 2 minutes.